Hey everyone, it's Danielle. I just had the end of my 7th shift as a scribe at Mount Sinai South Nassau, still working on a COVID floor. It's the basically just the remaining COVID floor in the hospital, which is an incredible thing to say, to see how slowly, week by week, shift by shift, there have been less and less COVID patients in the hospital, which, knock on wood, and stay at home, will continue. Anyway, today I wanted to talk about a concept called proning. And I wanted to bring it up because something interesting I find is that it's a maneuver that is recommended by most critical care societies normally, meaning outside of COVID times, because it decreases mortality in patients with ARDS, or acute respiratory distress syndrome, which many people with pneumonia and other types of lung infections will get, and that's what lands them in the ICU. So what proning is, when you lie on your back, that's called supine. And so proning is the other way. When you lie on your belly, you're supine. Now, the reason this works is we have to think anatomically and physiologically, meaning where in your body your lungs are and how they work. So your lungs are in your chest cavity, and they're more in the back posteriorly. So when you lie on your back, supine, basically you have the weight of your heart and of your muscles, and if you have a big abdomen, of your abdomen, all on your lungs when you're lying back, making it harder to breathe. Also, if you have fluid in your lungs, which is a thing that happens in ARDS, then you decrease the area for gas exchange, because when you lie flat, all the fluid is going to collect in the back because of gravity. So what happens when you go prone is you remove the weight of the heart, remove the weight of the chest, and you shift the fluid to be more towards the front of your lungs where you have less lung. That's important because it increases your surface area for gas exchange, meaning it creates more room for oxygen to get into the blood and CO2 to get out of the blood, which is very, very important. And the biggest reason we need to intubate people, to help people with that. So it's a thing that was always recommended, but hardly ever implemented in many, many hospitals, because it's a little bit labor intensive. But with the start of COVID-19, it became a big thing, even though it was unknown, and it's still unknown if it helps the mortality in patients specifically with COVID. But because we had no other medical treatments, pharmacologic treatments, like drugs, we decided to start proning. And basically now patients are being proned all the time if it's deemed necessary, in the appropriate cases. But it's interesting how we've so much fell back on using drugs as a treatment as opposed to remembering our anatomy and physiology of the body, and how a simple maneuver as flipping someone over, which of course is never as simple as you think it is, but also won't have the side effects of medications. How simple that is, and how easy it is we can forget to do things like that. So I think sort of a positive outcome of the pandemic is many more hospitals now are much more well equipped, well trained, and just more willing to prone. And I hope that's a practice that continues beyond this pandemic.